Health and Social Care Department's virtual bridging session. What we're going to look at in this session is how certain treatments for mental health conditions can link in to your coursework. So we're going to look at how mindfulness can link in to the treatment of depression. Okay. As part of the Health and Social Care qualification, we look at a variety of different units to try and give you an accurate reflection of the breadth of health and social care. So we might look at some psychology and different treatments. We might look at nutrition and factors that affect nutrition, alongside the vitally important mandatory topics such as health and safety, equality and diversity, and also anatomy and physiology. I don't really want to send you all off to be nurses and things like that if you don't know where the heart is. You can study health and social care as a single or a double A-level option. A single A-level option means that you'll get one A-level equivalent at the end of 2 years. A double A-level, which is called the diploma, means that you get 2 A-levels at the end of 2 years. If you complete the single qualification, you'll do 3 units in your first year and 3 units in your second year. The double award is double that. So it's 6 units altogether in the first year and 6 units altogether in the second year. Our qualification is designed to help you work with people. It's about helping you understand how to empathise with people, how to communicate effectively, how to try and empower them to make the best decisions for themselves. All of the coursework and the exam units that you do will relate to specific settings and specific practitioners within those settings, so that gives you a good overview and understanding of how you could actually apply those skills and that knowledge when you yourselves are in the workplace. One of the units that you will all cover is Unit 17, which is supporting people with mental health conditions. 1 in 4 people in the country will suffer from some form of mental ill health. So it's vital that we as people who work in health and social care have an understanding as to the signs, symptoms, treatments, and the support that's available for people with mental health conditions or those who suffer from mental ill health. Okay, so as a unit, that's exactly what we're going to look at. We're going to look at the different types of mental ill health, and we're going to look at how you can offer support as a health and social care practitioner. Like most of the coursework units, the first sections are generally knowledge-based, so they ask you to look at the facts and the main ideas surrounding a particular topic. The first section of Unit 17 wants you to know about the concepts, the different types, and the effects of mental health conditions, before in LO2 we move on to looking at the support that's available. P2 wants you to look at particular treatments that can be used to support individuals with mental health conditions. We're all going to look at depression, with it being one of the most prevalent and common mental ill health conditions. There is then a list from the exam board that you can select from. So you might choose to look at anxiety, you could look at obsessive compulsive disorder, schizophrenia, or any other condition that's on the list. P2 requires you to suggest treatments, so you have to pick a minimum of 2 treatments per mental health condition. You need to explain what they are, the principles that underlie them, who implements them, how they could be implemented. One particular treatment we might look at would be mindfulness, because this is a treatment As I've said, mindfulness is a recognised treatment for depression. It allows people to rationalise their thoughts, feelings and sensations so that they don't become overwhelmed by them. They break them down into more manageable pieces so they're better able to deal with what's going on in their lives. The National Institute for Health and Care Excellence recommend mindfulness as a way of treating depression for those people who've suffered significant bouts of depression previously. There's a large amount of scientific evidence to show that mindfulness-based cognitive therapy can be as effective as some forms of medication and prevent further relapses. It's generally provided by the NHS and you normally referred by your GP. A course can last for up to 8 weeks, generally with a 2-hour session per week. There'll be practical mindfulness exercises and the opportunity for you to reflect to see whether what you've been doing is helping. Click the link at the top of the page to find out how you can be more mindful. These exercises are really useful, particularly in light of current circumstances. They really can help you cope with the stresses and strains of day-to-day living. Listen to this fantastic podcast by Professor Mark Williams as part of the Mental Health Foundation. If you fancy taking part in some meditation, follow the steps below. There's also a link to a really useful YouTube clip. Should last only about 10 minutes. Here are some other mindfulness activities you can practice. What about 1-minute exercise and sitting in front of a clock? You could also take your time eating and really think and pay attention to the food that you eat. Exactly the same if you go for a walk. Think about what's around you, how you feel, what the weather is like, how that feels. Can you feel the wind in your face? Or you could even try some de-stressing exercises. Finally, spending time crafting and doing something you enjoy could really help you focus your attention and let you forget about some of the stresses and strains of the day. You could try colouring, or you could even make something like a mindful mood jar.